The first 72 hours after surgery are the most painful, but generic local anesthetics and other longer-acting local anesthetics inconsistently provide pain relief beyond 12 to 24 hours. This has created an efficacy gap that has contributed to the extensive use of opioids to manage postoperative pain. To fill that gap, healthcare providers often turn to opioids, which are readily available and relatively inexpensive. But as we're all very aware, opioids come at significant health system costs. Each year, there are more than 50 million surgeries performed in the United States, and 67% of patients who undergo surgery fill an opioid prescription in association with their procedure. More than 2 million patients may become persistent opioid users annually after surgery. ZYNRELEF is the first and only extended-release dual-acting local anesthetic. It is administered via a novel, needle-free application and has been proven to reduce pain intensity for up to 72 hours after surgery, reducing or eliminating the need for opioids in many patients. One of the reasons generic local anesthetics and other longer-acting local anesthetics inconsistently provide pain relief beyond 12 to 24 hours after surgery is because the inflammation at the surgical site can increase the amount of bupivacaine that becomes ionized and is then unable to penetrate the nerve cell membrane and block pain signals. ZYNRELEF addresses this problem by combining bupivacaine with a low dose of the non-steroidal anti-inflammatory drug meloxicam, which is thought to reduce the acidic effect caused by local inflammation, reducing the concentration of hydrogen ions. This allows considerably more bupivacaine to penetrate the cell membrane and block pain signals. There are a lot of things that make ZYNRELEF different from other available local anesthetics, both generic and branded. It's the only local anesthetic considered by the FDA to be designated as extended release, based on proven superiority to bupivacaine hydrochloride solution through 72 hours. It also has a unique dual-acting mechanism of action and is formulated in a biochronomer polymer, resulting in a synergistic analgesic effect. I believe ZYNRELEF can become the main pillar of postoperative pain management. This will allow us to manage painful surgical cases with fewer opioids or even without the use of any opioid medication. I think this will have a dramatic effect on the number of people exposed to opioids, which will help alleviate the complications and side effects associated with them. ZYNRELEF has been shown in multiple studies to decrease baseline pain from the moderate to severe range down to a range that is much more tolerable. Of course, significantly reducing a hernia patient's pain is important in and of itself, but reduction in pain intensity also naturally correlates with a reduced need for opioids following surgery. Even without any other non-opioid analgesia, when treated with ZYNRELEF, patients' average opioid consumption was 10.9 morphine milligram equivalents. That's a 25% reduction compared with bupivacaine hydrochloride, and a 60% reduction compared with placebo. And 51% of patients treated with ZYNRELEF were completely opioid-free through 72 hours post-surgery. In fact, of the patients who were opioid-free at 72 hours, 85% remained opioid-free through the 28-day recovery period. Heron is also studying ZYNRELEF in combination with a scheduled non-opioid regimen of oral over-the-counter analgesics, acetaminophen and ibuprofen, in the HOPE project, where study conditions are more similar to those of a real-world setting. Results of the completed HOPE-1 Part 1 herniorrhaphy study show that when used as a foundation of a non-opioid multimodal postoperative pain regimen, ZYNRELEF can reduce or eliminate the need for opioids in many patients following surgery. 91% of patients were discharged without an opioid prescription, with no callbacks to ask for additional pain medications. 97% of patients were completely opioid-free after being discharged. We saw these kinds of results both in patients who took alternating doses of acetaminophen and ibuprofen and in patients who took concurrent doses. In my practice, this has dramatically decreased the need for opioids after inguinal hernia surgeries. The slow release of the bupivacaine, combined with the effects of the meloxicam to keep the pH normal, has allowed patients to remain comfortable in the first 72 hours after surgery. This was simply not the case with local anesthetics before this drug was approved. In HOPE-1, Part 1, 93% of patients reported being satisfied, very satisfied, or extremely satisfied with their medication regimen. On average, patients were discharged 2.41 hours after surgery with only mild pain. Because ZYNRELEF is administered without a needle, there's no need for aspiration. Needle-free administration avoids risks associated with injected local anesthetics, including inadvertent venous punctures and accidental needle sticks. And while the needle-free application of ZYNRELEF is unique and novel, no specialized training is required to learn how to instill it in the hernia repair surgery. It should be clear that ZYNRELEF cannot and should not be injected. It should be applied to pain-generating tissues. Prepare the syringe according to the instructions for use. The instructions for use contain really good information about how to properly withdraw the product from the vial into the syringe. When it comes to administration, don't dilute ZYNRELEF with saline or mix with another local anesthetic, as it is not necessary to achieve efficacy, and it will make it more difficult to administer. Only apply ZYNRELEF to the tissue layers below the skin after final irrigation and suction. Before closing, be aware that upon application, the product will become even more viscous as it comes into contact with moisture in the tissues, allowing it to stay in place. Finally, while ZYNRELEF does not degrade sutures, they can cause a single knot to loosen or untie. So be sure to use at least 3 or more knots if you're using monofilament sutures. At my facility, we have had excellent results with hernia patients. We had over 20 patients at my site in HOPE-1, Part 1, none of whom needed postoperative opioids. We now have used it in about 30 patients outside of the trial since the drug has been FDA approved and have experienced the same results. We have seen almost no opioid use postoperatively. Patients are very surprised at the comfort level they are having after surgery. Most patients are extremely excited about this as they do not like opioids. One case does stand out to me in particular. It was a gentleman who had an open inguinal hernia repair about 5 years ago. In his postoperative visit, the patient was amazed and surprised about how well he did. He said his pain was not severe at all. He was able to get back to normal activity very rapidly. He was very surprised about how well this went and actually stated he'd be willing to talk to anyone about his experience. We have found it to be very successful in decreasing postoperative pain and reducing or eliminating opioid use. It seems to be well tolerated by patients, and I am excited to continue to use it in hernia patients and continue to track the data.
Indication. ZYNRELEF is indicated in adults for instillation to produce post-surgical analgesia for up to 72 hours after soft tissue and orthopedic procedures, including foot and ankle, and other procedures in which direct exposure to articular cartilage is avoided. Limitations of use. Safety and efficacy have not been established in highly vascular surgeries such as intrathoracic, large 4 or more level spinal, and head and neck procedures. Important safety information. Warning: risk of serious cardiovascular and gastrointestinal events. Nonsteroidal anti-inflammatory drugs, NSAIDs, cause an increased risk of serious cardiovascular thrombotic events, including myocardial infarction and stroke, which can be fatal. This risk may occur early in treatment and may increase with duration of use. ZYNRELEF is contraindicated in the setting of coronary artery bypass graft, CABG surgery. NSAIDs cause an increased risk of serious gastrointestinal (GI) adverse events, including bleeding, ulceration, and perforation of the stomach or intestines, which can be fatal. These events can occur at any time during use and without warning symptoms. Elderly patients and patients with a prior history of peptic ulcer disease and/or GI bleeding are at greater risk for serious GI events. Contraindications. ZYNRELEF is contraindicated in patients with a known hypersensitivity, example, anaphylactic reactions and serious skin reactions to any amide local anesthetic, NSAIDs, or other components of ZYNRELEF, with history of asthma, urticaria, or other allergic type reactions after taking aspirin or other NSAIDs. Severe, sometimes fatal, anaphylactic reactions to NSAIDs have been reported in such patients, undergoing obstetrical paracervical block anesthesia or undergoing CABG. Warnings and precautions. Dose-related toxicity. Monitor cardiovascular and respiratory vital signs in patients' state of consciousness after application of ZYNRELEF. When using ZYNRELEF with other local anesthetics, overall local anesthetic exposure must be considered through 72 hours. Hepatotoxicity. If abnormal liver tests persist or worsen, perform a clinical evaluation of the patient. Hypertension. Patients taking some antihypertensive medication may have impaired response to these therapies when taking NSAIDs. Monitor blood pressure. Heart failure and edema. Avoid use of ZYNRELEF in patients with severe heart failure unless benefits are expected to outweigh risk of worsening heart failure. Renal toxicity. Monitor renal function in patients with renal or hepatic impairment, heart failure, dehydration, or hypovolemia. Avoid use of ZYNRELEF in patients with advanced renal disease unless benefits are expected to outweigh risk of worsening renal failure. Anaphylactic reactions. Seek emergency help if an anaphylactic reaction occurs. Risk of joint cartilage necrosis and degeneration with unapproved intra-articular use. Animal studies evaluating the effects of ZYNRELEF following intra-articular administration in the knee joint demonstrated cartilage necrosis and degeneration. Chondrolysis. Limit exposure to articular cartilage due to the potential risk of chondrolysis. Methemoglobinemia. Cases have been reported with local anesthetic use. Serious skin reactions. NSAIDs, including meloxicam, can cause serious skin adverse reactions. NSAIDs can also cause fixed drug eruption, FDE. FDE may present as a more severe variant known as generalized bullous fixed drug eruption, GBFDE, which can be life-threatening. If symptoms present, evaluate clinically. Drug reaction with eosinophilia and systemic symptoms, DRESS. If symptoms are present, evaluate clinically. Fetal toxicity. Due to the risk of oligohydramnios, fetal renal dysfunction, and premature closure of the ductus arteriosus with NSAIDs, limit use of ZYNRELEF between about 20 to 30 weeks gestation and avoid use after about 30 weeks. Hematologic toxicity. Monitor hemoglobin and hematocrit in patients with any signs or symptoms of anemia. Drug interactions. Drugs that interfere with hemostasis. Monitor patients for bleeding who are using ZYNRELEF with drugs that interfere with hemostasis. Example, warfarin, aspirin, SSRIs, SNRIs. ACE inhibitors, angiotensin receptor blockers, ARBs, or beta blockers. Use with ZYNRELEF may diminish the antihypertensive effect of these drugs. Monitor blood pressure. ACE inhibitors and ARBs. Use with ZYNRELEF in elderly, volume depleted, or those with renal impairment may result in deterioration of renal function. In such high-risk patients, monitor for signs of worsening renal function. Diuretics. NSAIDs can reduce natriuretic effect of furosemide and thiazide diuretics. Monitor patients to assure diuretic efficacy, including antihypertensive effects. Use in specific populations. Infertility. NSAIDs are associated with reversible infertility. Consider avoidance of ZYNRELEF in women who have difficulties conceiving. Severe hepatic impairment. Only use if benefits are expected to outweigh risks. Monitor for signs of worsening liver function. Severe renal impairment. Not recommended. Adverse reactions. Most common adverse reactions, incidence greater or equal to 5% in controlled clinical trials with ZYNRELEF, are soft tissue procedures, vomiting, and orthopedic procedures, constipation, and headache. Report side effects to Heron at 1-844-437-6611 or to FDA at 1-800-FDA-1088 or www.fda.gov www.nscpharmacy.com/medwatch. Please see full prescribing information, including box warning and updated warnings and precautions for serious skin reactions caused by non-steroidal anti-inflammatory drugs, NSAIDs.